This topic is airway management. It's going to include things like intubation, extubation, suctioning, and the different types of artificial airways. So we're going to start with suctioning. This is the application of a negative pressure to the airways through a collecting tube. Suctioning of the trachea and bronchi is usually done through an endotracheal tube or a tracheostomy tube. However, sometimes there's a technique called nasal tracheal suctioning that's done just by application of a catheter through the nose. So first of all, the vacuum regulator is going to be set on the wall, and usually is a quick connect device, much like your oxygen hoses. And there's an adjustment here. Okay, this actually is the adjustment part. Okay, and then up here you may have some sort of intermittent type setting, whether it's continuous or off or intermittent. That's what we look for up here. And then, of course, this is the amount of vacuum pressure that's applied to the suction catheter itself. All right, and you see, so it's got low, medium, and then high, and then this is centimeters of water pressure here on the inside scale. All right, we'll talk about in a minute, but I think as you'll figure out, there's no reason to ever go over 120 on your vacuum pressure. Same thing in your car, right? Your speed limit's 120 in the car. Well, your vacuum limit is 122, and we'll talk about some of the complications that brings with it if you go over 120. In addition, in this area here, this is going to be where you plug the tubing in. The tubing that actually goes to the canister that's hanging on the wall. That's your collection device, where you're going to collect all the secretions that you suction out, or the fluids. This is a sterile technique nasal tracheal suction catheter, and this is probably a size 14 French. 14 French seems, 14 is typically a popular size, and that's usually what you'd use on a normal size adult. Okay, a couple of things about this is this is called the thumb port, this area right here, and so until you occlude this port, all the suctioning is occurring through here. Okay, and once you plug this up with your thumb, then that converts the vacuum down through the catheter here, and so it's suctioning in through here. And in addition, I don't know if you can see or not, but this area right here, that little hole in there, that's called a Murphy eye. And what that's about is many times the tip of this may become occluded for whatever reason, whether you get up against the tissue, just where you suck the tissue up in there, like you're sucking a hickey on the lungs. Okay, what the Murphy eye is about is so that it kind of diverts that pressure and minimizes damage to that tissue that you're stuck on there. So, but that's the Murphy eye. This is what we refer to as a tonsil tip suction catheter, or Yankauer, whichever one you want to call it. This is just for suctioning out the back of the mouth, or the mouth. This is not flexible at all. Okay? And you see here that this end of the tube actually connects to the canister, and this part is the area that's used to insert into the mouth to suction the secretions out of. And some of these Yankauers have a thumb port which is just a hole. There's nothing sticking out. It's just a hole that you have to occlude to apply the suction down here. Okay, and so we use this a lot for when we're doing oral care and we're having to suction out the back of the mouth, or even down above the vocal cords before extubation. The NT suctioning equipment usually comes in a kit. You see the container there in the upper left-hand portion. This is where you're going to pour your. This is probably what everything came in to begin with, but you're going to open this in an aseptic technique, and what you're going to do is you're going to pour your water that comes in the little container into that, so that you can use that to clean your suction catheter. All right, and so this is your sterile water that you just dump into this. Okay, and in addition, you're going to have sterile gloves. Right now, you notice that there's a cuff on the gloves there. So as you put this on, and I'll show you how to do this in lab, but as you put this on, you have to use a sterile technique so that you don't contaminate your gloves or any of your equipment as you put this stuff on and pick it up. So we'll demonstrate that a little bit more in the lab. So here's a video that I found on the internet. What she's using here is a closed suction system, and we'll get to that in a minute. But there's a number of things here. This is with the NT suctioning, the sterile equipment, you discard it after you're finished. But this one you're going to leave on in the circuitry for 2 to 3 days. This is usually done with a patient that's has an artificial airway in, and so there's no need then to suction through the nose. But because that airway is there, their cough is impaired, and they need some assistance usually with their secretions. All right, so let me try and play this and see if we can get anything out of it.
In this video, we're going to be looking at this little device, which is an amazing device. It's really in place for our protection as healthcare providers. It has been around for quite a few decades, but became especially more important in our use after we had SARS. This is called the Deep Inline Suctioning Catheter, and it provides a closed suctioning loop so that we are protected. I'm still going to be donning my gloves, and if I am concerned about the virility of this person's problem, then I might end up having to also do mask as well. There is only one way to attach this. And this is for somebody obviously who has an endotracheal tube. I have this port is going to be connected to my suction source, and when not in use, I want to make sure that my suction port is locked. I don't want the patient or somebody to inadvertently compress this and the patient is continuously being suctioned. So when I do want to use this port, here, this is going to go to my ventilator for my oxygen source. And this is what I'm going to use after I've done my suction to ensure that I've cleaned out this tube. So in preparation for doing my deep inline tracheal suction, I'm going to put the device in the engaged position, okay? And I'm then going to insert this catheter until I feel that slight resistance and notice that the patient is starting to gag. Taking no more than 10 seconds, I'm going to slowly withdraw as I'm applying my suction. And then to clean out the suction itself, the suction catheter, I'm going to open up this port, and I'm going to either instill with a little pre-filled ampule or syringe of saline. While I'm compressing on the catheter, I'm going to put in 10 cc's of saline while I'm pressing this to make sure that this is cleaned for next use. These usually get changed every 2 to 3 days. It's usually done in the ICU by the RT. And this is a great device to protect us. If you would like any further information on our series for airway management, please check us out at www.
So here's what she was talking about, something like this, where you have that thumb control there, and this is where you apply the suction, and you see this goes to the canister on the wall. Okay, so it's attached to that vacuum tubing that runs to the canister. Then you have the clear sheath covering the catheter here. That's the reason you don't have to change this out all the time, is because that sheath protects it. Now if this thing becomes soiled or gets clogged or something like that, you'll need to change it. And in some cases we'll change it every day too, because it'll get to where it doesn't work very well. But closed suction. The lavage port that she was talking about here, this is where you might instill some saline. We used to instill saline every time we suction back in the old days, but now they're concerned that that is one of the main causes of ventilator-associated pneumonia. They say that the endotracheal tube here will colonize in bacteria, and if you try to squirt liquid saline down there, then it will wash those bacteria into the lungs and cause pneumonia. So we try to, we still do it, but we minimalize that process. If they have very thick secretions, and sometimes it's required, but we don't do it routinely. All right, and so also with this type of suction catheter, many times you have condensation, or that you have secretions that collect in the tubing here. Just to clean that out, that's what this removable plug is about. You just pop that off and it'll spray right out of there. Be careful not to get any of that on you. But that's one of the benefits of that plug there. There's another one too that we'll get to, but right now that's it. I think I want to end the video here. We'll do another one on indications and complications.